When a patient has been diagnosed with a terminal illness or a loved one is nearing their last days, many people reach out to hospice organizations to provide care and comfort. Yet many people don't really understand the role of hospice or when hospice can be called to assist a family. Joining me with more is Beth Buxton. She's a funeral director with Edwards Funeral Services, along with Jeremy Borman, the director of clinical services at St. Joseph's Hospice. And welcome to both of you, and this is a great topic to share with our viewers today.
Thanks for having us.
Beth, I want to start with you because most people don't think, as a funeral director and having a funeral service, that you work with hospice organizations because you are dealing with the after death. How does that happen, that you help families and direct them to hospice?
We do work well together. I wanted to bring Jeremy on with St. Joseph Hospice just to show the relationship that funeral homes do have with hospice groups and how we both help families in a transition when there's an illness or a death occurs.
And do you find that when you move your clients toward hospice, that there is a sense of relief there in the family?
There really is. When people come in and plan in advance, a lot of times there's an illness involved, and it could be an imminent situation or not. But we want people to know that there's education out there for them and options at hospice that they need to be aware of. And they need to call hospice and find out what those are.
What does hospice consist of, Jeremy? What services?
It's really additional care for the patient, but it depends on what their needs are. And we also assist the family with any grief counseling, social work. But really, we're just there additionally at the end of life.
And people still don't know, though, when should they call you for assistance? And I've heard different people who work with hospice say, you know, many times they wait too long when they could have been getting extra help. And
really, any time that a family has a question, they should call, especially at St. Joe's. I mean, we're willing to talk to people about any situation. So if they question whether is it really time to call hospice, call us and we can talk to you about it.
So hospice isn't just if a person is ready to die. I mean, it can be, what, months, weeks?
We have patients that have been on service for a year.
Have you?
Yes. They may have a life-limiting illness, but death may not be an imminent situation, but they can still benefit from all those added services.
Can a family outright call hospice, Jeremy, or does a doctor have to refer them? How does that part work?
The family can call us, and then we can take care of all the paperwork and contacting the doctor, so we can take that burden off the family.
Well, part of that paperwork is cost, and I know many people are like, well, we waited till the last minute because we weren't sure if we could pay for it. How does that work for the most part?
Basically, your entire life, when you look at your paycheck, you've paid for hospice because all those Medicare taxes. So it's covered under Medicare, Medicaid, and then most major insurance providers cover.
And that has to be a comfort to families too.
Yes. Yeah, because they're not incurring that additional cost for the additional care.
How do you describe hospice to people as to what type of services you actually provide, hands-on?
I mean, additional nursing service. We help with medication, and pain management would be a big one. But I think just helping people live at the end of life versus viewing it as dying, I think just helping them resolve issues at the end of life is how I view hospice.
That's really interesting that you talk about, instead of looking at dying, and looking at living in those last days and how they want to live those last days.
Absolutely.
And for some people it's in their home, others it's in a facility, and how do you decide which is best?
It's wherever the patient calls home. So if they're in a facility, then we're going to go to the facility. If they're at home, it's wherever they call home is where we go.
And I'm sure there are many people, Jeremy, that feel like as they're listening to this, they're never going to need it. Right. But if they feel that they do need it, as you said, they shouldn't hesitate to call, because you can explain to folks what you can offer, and whether it's the time.
Right. I mean, anytime they would call us at St. Joe's, we certainly would answer any questions and help walk them through any situation.
And Beth, when would you lead someone to hospice? I mean, what is your role as far as helping someone decide that it's the right time?
Of course, I don't make that decision, but I do guide them to please call, get an assessment from hospice to see if it is the right time and if it's the right service for them at that time. I know that hospice workers have told me there are situations where families have had a loved one go on hospice and even go off hospice and go back on later.
And that's all okay?
It's all okay. It's all individual. It's just a matter of what do they need, and hospice can help them assess that.
And what's the reaction from some of the clients that you do, nudge toward hospice?
When they come in, especially after death has occurred, they tell us how wonderful hospice is. I admire hospice and what they do. They comfort that person that's dying, but they also comfort the family. That's important for those surviving family members to have that peace of mind.
It certainly is. Jeremy, thank you for joining us today. Beth, good to see you again.
Thank you.